What sort of bias is a huge issue in case control studies? Recall bias. hmm Recall bias is a huge issue in case control studies. If you're in your cardiovascular clinic and you have a patient that cannot exercise, but coronary artery disease is suspected, how can you stress them to see if that's actually an issue? Do a pharmacologic stress test, right? And with regards to medications that you think are working, that are new, you got to be aware of latent periods for those medications, okay? And note that cholestyramine can be used to treat bile salt induced diarrhea. So, what can be used to treat bile salt induced diarrhea? Cholestyramine. People that want their family to not smoke should be encouraged and given assistance to quit themselves, right? hmm hmm Persons or people that are not at risk of bone issues, do they need osteoporosis medications? Nope, no, they don't. That'd be silly to give someone a medication that they don't need. Patients with sickle cell disease are at risk for what sort of crises that starts with an A? Aplastic crises. And if you were talking to a patient that's trying to bend insurance rules and whatnot, you should say something like this. Look, as a physician, you should follow the insurance rules. And do that in your practice as well. Don't be letting, the nurse, cook the books or whatever, because you'll get in big poo-poo if you do that. If a baby patient has sensorineural hearing loss, cataracts, and a patent ductus arteriosus, what sort of syndrome should you suspect? Congenital rubella syndrome. They are having trouble hearing, cataracts, and a patent ductus arteriosus. That's rubella. If you're given an image of an optic disc, you should be able to recognize CROW immediately, and you should definitely suspect it in a patient with afferent pupillary defect. Note, don't be fooled. A dose-response relationship does not infer causation. Don't get tricked. In order to decrease postoperative risk, postoperative complication risk, patients should not smoke 4 weeks before what? Before your surgery. 4 weeks before your surgery, no smoking. If I catch you smoking, you're not coming into my OR. But no, you need to be empathetic with your patients and ask them follow-up questions. I feel your pain. I see that you have questions. I'm here to answer them. A patient with end-stage renal disease, note that they can also have anemia, so they should be getting treated for iron deficiency anemia. What's the time frame of having psychotic symptoms to diagnose schizoaffective disorder? It's greater than or equal to 2 weeks of psychotic symptoms. A patient on amantadine but getting psychosis should reduce dosage or taper off, right? I'll say that again. A patient on amantadine that's starting to act weird and have psychotic-like behavior, you need to reduce that amantadine or taper them off. If you have a kid with scoliosis, what should you do? What imaging should you do? An x-ray of the spine. A Cobb angle less than 10% is within normal limits, by the way. So you just follow up and check to see if they have any neurological symptoms. If they don't, then they're good to go. Also, you need to know how to treat lead toxicity and how to recognize it. So there's mild, moderate, and severe. And with regards to those, it's 5 to 44, 45 to 69, and 70. So 544, 69, 70. 544, 69, 70. The mild doesn't really need a treatment. The moderate, 45 to 69, can use DMSA and Suxamir. And severe is greater than or equal to 70. And those patients need dimercaprol and dimercaprol and EDTA. Note that dextrose and octreotide are used to treat severe sulfonylurea overdose. Proper calcium and vitamin D levels are good for bones. Oral dopaminergic receptor agonists are the first medications that are used for prolactinomas. Okay? What's the first medications used for prolactinomas? Oral dopaminergic receptor agonists. Patients with transurethral resection of the prostate or TURP, what are they at risk of? Retrograde ejaculation. Yikes. Always remember, maintain the HIPAA compliance. And for Group B strep prevention in a newborn, when do you want to screen? 36 to 38 weeks. And if it's less than 37 weeks, you give that penicillin. If you have a patient with a pulmonary hypertension, what does the transthoracic echocardiogram help to estimate? Helps to estimate the pulmonary arterial pressure. And what medication helps treat pulmonary hypertension? Endothelin antagonists help treat pulmonary hypertension. Patients with carotid artery dissection need to have what? Head and neck CT angiography. What's the mnemonic used to manage STEMI? Mona Bash. Mona Bash to manage STEMI. Can retrosternal goiters causing symptoms be surgically removed? Definitely can. Retrosternal goiters causing symptoms can be surgically removed. What is the first line treatment for community acquired pneumonia in toddlers? Amoxicillin. Levothyroxine therapy is indicated in obvious settings of subclinical hypothyroidism, by the way. How do you diagnose bacterial enteritis? With a stool culture, right? And how do you treat bacterial enteritis? Treat it with an oral electrolyte therapy. If you're in the hospital and somebody is yanking up the call nurse, is it okay to call security? Yeah, you probably should. Sometimes you will need to call security, so be ready for that. A risk factor for endometriosis could include pain, abnormal menses, and infertility. So be on the lookout for that. If you have a patient with preeclampsia and you want to prevent it, what does that involve? Taking aspirin. So basically, aspirin can help prevent preeclampsia, by the way. True or false? Patients with transient ischemic attacks will not benefit in any way from a carotid endarterectomy. It's definitely false because patients with transient ischemic attacks are highly likely to benefit from a carotid endarterectomy. If your patient gets an IVC filter, what are they at increased risk of getting? DVTs, right? What does DNR mean? Do not resuscitate. That means no CPR, no intubation, all right? Does HPV vaccine decrease the risk of penile cancer? Yep.